Most parents, especially of young athletes, don't even consider until paramedics are rushing in. A new study shows cardiac arrest among teenagers is on the rise.
It's terrifying. Our Nohelani Graf live this morning. There is a clear risk factor here, Nohe, and a lot of parents at this point have no idea.
Yeah, it's surprising to a lot of people. Congenital heart disease is actually the #1 birth defect, and doctors say in almost every case where a child or a teenager collapses from a cardiac event, it was undiagnosed.
You go, April. There you go.
Kelly Miller is one tough mother, but nothing could prepare her for a major blow during a routine pregnancy checkup.
She just noticed that, blood flow wasn't right.
Her youngest son, Luke, would be born with several heart defects, not even a topic of discussion during her first pregnancy.
That's the hardest thing to see is your child laying there with all those tubes and wires coming out.
He would have open heart surgery at 16 days old, then again as a toddler with more to come.
Cardiovascular disease in our youth is becoming more common.
According to the American Academy of Pediatrics, as many as 2,000 young adults under 25 die of sudden cardiac arrest each year, and most had heart disease but didn't know.
This is an EKG machine.
Cardiologist Dr. Timothy Byrne has been the team doctor for the Phoenix Suns for 29 years. He says every player gets an annual echocardiogram just to be sure. Something he says isn't standard when kids get a physical, but maybe should be.
But if all the kids have an EKG, that's the most powerful predictor of whether there's an issue or not.
At the very least, those with family history of heart disease should. 50% of kids will inherit it.
We were definitely lucky. Definitely lucky. Come on.
Knowledge is power, so for the Millers, early detection was a lifesaver. Luke is now a high-octane 5-year-old. Mom will always worry as he gets older, rougher, more athletic, because she knows where this could have gone.
His heart could fail. That's worst case.
But with proper care, the only heart in real trouble will be the ones he steals.
So Kelly's advice to expectant moms: ask for a longer ultrasound to get a good look at the baby's heart. Dr. Burns says if there is a family history, ask for your kid to have an EKG. And in our next half hour, the growing habit putting more teens at risk for developing heart disease. And Kaylee and Nick, I want to throw out there also, Kelly works out at Jabs. There are gyms across the valley, and they're all holding workout fundraisers this month to benefit the heart specialty area of Phoenix Children's Hospital.
Fantastic.
Yeah, that's amazing. And Nohe, I think they've done things to benefit pediatric cancer as well. So they do a lot of good things here in the Valley. Really, really good information here, Nohe. Thank you for that.
Boy, yeah.